Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a gastroenterologist talking to a patient called Mr. Harris. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Mr. Harris. It's nice to meet you. I see you've been referred by your GP regarding some digestive concerns. Is that correct?
Yes, that's right. I've been experiencing stomach pain, bloating, and sometimes I just feel tired for no reason. My GP mentioned it could be something related to gluten.
That's helpful to know. Based on your symptoms and what your GP noted in your file, one possibility is celiac disease. Celiac is an autoimmune condition triggered by consuming gluten, which is a protein found in wheat, barley, and rye. But first, let's go over your symptoms a bit more. How long have you been feeling this way?
It's been on and off for a couple of years, honestly. Sometimes it's mild, but other times I'm doubled over with stomach pain. I also feel incredibly tired most days, even after a good night's sleep.
That must be challenging. Fatigue is indeed common in celiac disease, along with symptoms like bloating, diarrhea, and sometimes nutrient deficiencies because of poor absorption in the gut. Do you experience any skin rashes or unexplained weight loss?
I've had a bit of weight loss, but I thought it was just from stress. And yes, I do sometimes get itchy rashes on my elbows and knees, but I didn't connect it to my stomach issues.
That's insightful to mention. The rash you're describing could be a condition called dermatitis herpetiformis, which is common among people with celiac disease. It's an itchy, blistering skin rash that can appear on areas like the elbows, knees, and sometimes the buttocks. Together with your other symptoms, this strengthens the suspicion of celiac disease. However, we'll need to confirm with a few tests.
What kind of tests are we looking at?
The initial step is a blood test to check for certain antibodies that are typically elevated in people with celiac disease. If the blood test suggests celiac, the next step would be an upper endoscopy with a biopsy of the small intestine. This helps us assess any damage to the villi, which are the tiny finger-like projections lining your intestine. They absorb nutrients, and in celiac, they often become damaged from the immune response to gluten.
Is it a serious condition if I do have it?
Celiac disease is quite manageable with lifestyle adjustments. However, if left untreated, it can lead to complications such as osteoporosis, anemia, and in rare cases, an increased risk for certain cancers. The good news is that once diagnosed, managing it effectively involves following a strict gluten-free diet. This diet helps alleviate symptoms and allows the intestinal lining to heal.
I see. So, I just avoid bread and pasta then?
Yes. But gluten can also be hidden in unexpected places, such as sauces, marinades, and even some medications. Reading labels becomes a part of daily life for most people with celiac disease. Gluten-free alternatives are widely available now, though, which makes the diet easier than it was a decade ago.
How soon would I start to feel better if I do have celiac and cut out gluten?
Many patients notice an improvement in symptoms within a few weeks of starting a gluten-free diet, although full recovery of the gut lining may take longer. It's essential to stick strictly to the diet, as even small amounts of gluten can trigger symptoms and ongoing inflammation.
And would I need follow-up appointments after the diagnosis?
Yes, definitely. We'll want to monitor your recovery and check your nutrient levels periodically, since people with untreated celiac often have deficiencies in iron, calcium, and certain vitamins. Following up ensures that your diet is meeting your nutritional needs, and we'll also check on any ongoing symptoms you might have.
Makes sense. It sounds like it might be a big change, but if it helps me feel better, I'm willing to try.
I'm glad to hear that, Mr. Harris. It can feel overwhelming initially, but many people with celiac disease lead full, healthy lives by making these dietary adjustments. There are also great resources, like dietitians who specialize in gluten-free diets, to help guide you.
Thank you. I feel better knowing there's a clear path forward.
Of course. Let's start with the blood test, and I'll have my team follow up with you once we have results. If you do have celiac, we'll walk through all the necessary steps together. In the meantime, don't hesitate to reach out with any questions.
Thank you. I'll get the test done as soon as possible.
Excellent. I'll be in touch soon, Mr. Harris. Take care, and we'll talk again soon.
Extract 2, questions 13 to 24. You hear a therapist talking to a patient called Mrs. Sherin. For questions, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Mrs. Sherin. How are you feeling today?
Well, it's been a bit uncomfortable, to be honest. My ear feels full, and I can barely hear from my left side.
I understand. That full, blocked sensation can be very frustrating. Today, I'll be assessing your ear health and discussing how we can address the earwax buildup that seems to be causing this blockage. How does that sound?
Sounds good. I hope we can get rid of this feeling soon.
Let's start by talking a little about the symptoms you're experiencing. How long have you been feeling this blockage in your ear?
It's been about 3 weeks now. At first, I thought it was just some water trapped after a shower, but it hasn't gone away. I've also noticed that sounds are muffled, and there's this weird pressure in my ear.
That sounds uncomfortable. Besides the pressure and muffled hearing, have you noticed any pain ringing in the ear or dizziness?
A little ringing at times, but no pain or dizziness. Mostly it just feels like my ear is stuffed up.
Thank you for clarifying. Based on what you've described, it does sound like earwax buildup could be the cause of these symptoms. Earwax can sometimes accumulate and harden, creating a blockage that impacts hearing and causes discomfort.
Yes, that's exactly how it feels. Is this common?
Yes, it is quite common, especially when earwax naturally builds up faster, or if cleaning habits inadvertently push wax deeper. But the good news is that we can help alleviate it. I'll take a closer look at the ear and check for any visible blockage. Just as we suspected, there's a significant buildup of wax in your left ear. It appears to be quite dense, which would explain the blocked sensation and muffled sounds. How do you feel about exploring options to clear this blockage?
I'd be relieved. Anything that can help me hear better.
Absolutely. There are a few options we could consider. One method involves using ear drops to soften the wax. These drops contain oils or hydrogen peroxide, which can gradually dissolve the earwax over a few days. You would apply a few drops, let it sit for a few minutes, and then let it naturally drain. This is a gentle, non-invasive approach.
So, I wouldn't need to do much, just use the drops?
Exactly. You may need to repeat it a few times a day, but it's quite simple. Now, if the drops don't provide enough relief, there's also the option of ear irrigation, a procedure we can do here. We gently flush the ear canal with warm water to dislodge and remove the wax.
Does it hurt?
It's generally comfortable, though you may feel a bit of pressure or tickling during the irrigation. We'd adjust the flow to ensure it's as gentle as possible. Many patients feel immediate relief after this treatment.
That sounds promising. I wouldn't mind trying the drops first though if they're gentler.
A great choice. Starting with ear drops is often an effective way to soften the wax, making it easier to remove naturally or with minimal intervention later. I'll also provide instructions on how to use the drops and what to expect as the wax begins to loosen.
Thank you. Is there anything else I should do while using the drops?
Yes, good question. Try to avoid using cotton swabs or inserting any objects into your ear, as they can push the wax deeper. You can also sleep on your opposite side to allow the softened wax to drain more naturally.
Makes sense. I usually use swabs, but I can stop if it helps.
Perfect. Stopping the use of swabs can actually help prevent future blockages. Finally, if we don't achieve full relief after a week, we can consider the irrigation option to clear any remaining wax.
That sounds good to me. So I'll start with the drops, and then we'll see how it goes from there?
Yes, exactly. I'll provide you with the drops today, and we'll schedule a follow-up in a week to check your progress. If you're still feeling blocked, we can perform the irrigation then. I'm glad we have a plan to get you back to hearing clearly and feeling comfortable.
Thank you. It's such a relief to know this can be managed.
My pleasure, Mrs. Sharon. We'll work together to clear up the blockage and help you get back to normal hearing soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 trainee doctors talking to each other. Now read the question.
So, what's the first task we need to work on today?
We're going to take part in some role-playing scenarios. We have to practice communicating with patients in different situations, such as delivering bad news, explaining treatment plans, and handling difficult patients.
That sounds interesting. And do we need to stick to a specific scenario?
No, the idea is to cover a range of situations. The goal is to practice our communication skills and problem-solving abilities, so we can handle real-life challenges more effectively. After each scenario, we'll discuss what went well and what could be improved.
Okay, that makes sense. Let's get started then.
Now look at question 26. You overhear a conversation between an intern and a senior neurologist in the clinic. Now read the question.
And speech difficulty. The symptoms began after waking up this morning and have been progressively worsening. He has a family history of early-onset strokes, with both his father and uncle having suffered strokes in their early 30s. On examination, the patient has hemiparesis on the left side, and speech is mildly slurred. We performed an MRI of the brain, and here is the result.
So, what do you think is the diagnosis?
Based on the clinical presentation, family history, and MRI findings, this appears to be CADASIL, cerebral autosomal dominant arteriopathy with subcortical infarct leukoencephalopathy. It's a rare genetic disorder that causes multiple strokes and can lead to cognitive decline, often in young adults. The MRI shows typical changes, including subcortical infarcts and leukoencephalopathy, which are characteristic of CADASIL.
What is your next step in managing this patient?
We would recommend genetic testing to confirm the diagnosis, followed by management of vascular risk factors and potentially starting medication to address the strokes.
Now look at question 27. You hear a nurse explaining about emergency situations. Now read the question.
As you all know, our hospital regularly faces emergency situations, ranging from natural disasters to large-scale accidents. Starting next month, we will be implementing an updated emergency response training program for all staff. This program will focus on disaster preparedness and patient evacuation protocols. The aim is to ensure that we are all well prepared to respond quickly and effectively in the event of a crisis, ensuring the safety of both patients and staff. The training will cover various emergency scenarios, including fire evacuations, medical emergencies, and evacuation of patients with special needs. We recognize that this will require collaboration and practice, and that the success of this program depends on everyone's active participation. Any questions or concerns regarding the training can be directed to Mark in the Safety and Compliance Department.
Now look at question 28. You hear a nurse talking about a patient. Now read the question.
This is Emily Davis. She's a 7-year-old girl who has been brought in with a high fever and flu-like symptoms. She's been complaining of body aches, a sore throat, and a persistent cough. We've started her on fluids to keep her hydrated, but her fever is still quite high, around 39 degrees Celsius. We've also given her some ibuprofen to manage the pain.
I see. Has she been able to keep fluids down so far?
Yes, she's been drinking water and some clear broth, but she's been a bit lethargic and not very interested in eating.
Right. Let's continue with the fluids and monitor her fever closely. I think we can also give her some paracetamol for her fever if it doesn't come down after the ibuprofen. Let's aim to keep her comfortable while we watch her progress over the next few hours.
That sounds good. I'll make sure we keep her well hydrated and continue monitoring her temperature.
Now look at question 29. You overhear a conversation between a nurse and a social worker about a patient's request for some time outside the ward. Now read the question. I understand Mr. Harris wants to go for a walk outside, but he's been really struggling with his anxiety lately.
But he's been in here for weeks now and is mentioned feeling like he's losing touch with reality. A change of scenery might help him.
I agree that a change of environment could be beneficial, but he's still having a lot of panic episodes. I don't want him to become overwhelmed outside the ward.
Maybe we can go with him just for a short walk around the hospital grounds. It might help him feel more grounded.
I'd prefer to wait until he has a little more stability with his therapy sessions. I'm worried that pushing him too soon could worsen his mental state. Now look at question 30. You hear a surgeon talking before a patient's procedure. Now read the question.
How are you feeling today? I'm Dr. Adams, and I'll be performing your rotation-plasty procedure today. Are you ready to discuss the surgery?
I've been reading about it, but I'm still a bit confused. Can you explain it to me in simple terms?
Of course. The idea behind rotation-plasty is that we'll be removing the lower part of your leg, including the ankle joint. Then, we'll rotate the remaining part of your foot 180 degrees and reattach it to your thigh. The foot will function as your new knee joint.
So, my foot will be where my knee is?
Exactly. It may sound a bit strange, but the foot will be positioned in such a way that it will allow you to use a prosthetic more effectively. This way, The prosthetic will be more stable and functional.
Will I be able to walk again with it?
Yes, the goal is to give you better mobility. Once the surgery heals, you'll be able to use a prosthesis that fits securely into your newly positioned foot, allowing you to walk and even run more effectively than with a traditional amputation.
Okay, I think I understand it better now. Let's go ahead.
Great, let's get started then.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview with Dr. Sarah Lane. You now have 90 seconds to read questions.
I'm joined today by Dr. Sarah Lane, a neurologist who specializes in treating patients with multiple sclerosis called MS. Now, MS is a progressive condition that can have an enormous impact on day-to-day life. Dr. Lane, what are some of the biggest challenges people face as their MS symptoms progress?
Well, MS affects each individual differently, but common symptoms include muscle weakness, fatigue, and issues with coordination. For many patients, the unpredictable nature of MS is the hardest part. For instance, one of my patients, let's call her Emily, told me that she never knows if a day will be good or bad. She might have plans, but then find herself unable to move around or manage basic tasks because of a sudden flare-up. And while some patients come to terms with the physical limitations, it's often the emotional burden that can be overwhelming.
And managing these symptoms must require considerable adjustments. What do you typically suggest for patients who want to maintain some independence?
Maintaining independence is a huge goal for many people living with MS. Fatigue is often the most disabling symptom, so I encourage patients to conserve their energy by prioritizing tasks and taking frequent rest breaks. It also helps to organize daily activities strategically, for instance, completing more demanding tasks when they feel most energized. Assistive devices can also be life-changing. Some patients may use a cane, walker, or other aids to help with mobility and avoid accidents.
And does exercise play a role in managing the symptoms of MS?
Absolutely. While exercise doesn't prevent MS, it can be immensely beneficial in managing its symptoms. Many people with MS find that low-impact exercises like yoga, swimming, or Tai Chi help maintain muscle strength and flexibility. One study I was involved in showed that regular tailored exercise actually improves energy levels and reduces fatigue. But the key is to pace oneself. Overdoing it can lead to even more fatigue. So I advise patients to listen to their bodies and adjust accordingly.
Now, I understand that medication can help manage symptoms too. Could you explain how these treatments work?
Of course. MS medications generally fall into three categories. First, disease-modifying therapies, or DMTs, aim to slow down the progression of MS. These can be really effective, especially when started early. Then we have symptom management medications, which help relieve specific issues like muscle spasms, pain, or bladder problems. Finally, there are medications for managing relapses. For instance, corticosteroids can shorten the duration of a relapse, but won't affect the overall progression of the disease.
And there have been some exciting advancements in MS treatment lately, haven't there?
Yes, there have. One of the most promising areas of research right now is stem cell therapy, which aims to repair damage to the nervous system caused by MS. Clinical trials are still ongoing, but preliminary results are encouraging. Patients who've tried it report some improvements in mobility and even a reduction in relapses. Another exciting area is neuromodulation, which involves using electrical stimulation to help reduce symptoms. However, these treatments are still in experimental stages and aren't widely available just yet.
Do you have any final advice for people living with MS or for their families and caregivers?
I'd say that having a good support system is essential. MS is challenging not only for those diagnosed, but for their loved ones too. Finding ways to adapt together and maintain open communication makes a world of difference. And for people living with MS, it's important to stay informed about new therapies and maintain a positive outlook. The advancements we're seeing in research are giving patients real hope for the future.
Extract 2. Questions 37 to 42. You hear Dr. Nolan Spencer talking about a chronic skin condition called rosacea. Now, read the questions. You now have 90 seconds to read questions.
Hello, my name's Dr. Nolan Spencer. I'm a dermatologist, and today I'll be talking about a chronic skin condition called rosacea. Rosacea is quite common, though it's often misunderstood. It primarily affects the face and is characterized by redness, visible blood vessels, and in some cases, acne-like bumps. These symptoms tend to flare up for weeks or even months, and then subside for a time before potentially flaring up again. Rosacea can have a significant impact on self-esteem and confidence, as it alters the facial appearance, which can be distressing for patients. One of the complexities of treating rosacea is that it can be mistaken for other skin conditions, such as acne or even eczema. This confusion often delays proper diagnosis and, consequently, effective treatment. Patients usually report feeling frustrated by the repeated redness and flare-ups, which can sometimes be painful or even stinging. It's worth noting that while rosacea affects people of all skin types, those with fair skin, particularly individuals of Northern European descent, seem to be more prone to it. The exact cause of rosacea remains unknown, but we believe it is a result of an overactive immune response. Unlike other inflammatory skin conditions, rosacea doesn't appear to be caused by bacteria, but rather, it involves an intricate interplay between genetics and environmental factors. One key aspect of managing rosacea is identifying and avoiding triggers that exacerbate symptoms. Common triggers include exposure to sunlight, emotional stress, hot or cold weather, spicy foods, and even certain beverages, especially hot drinks or alcohol. Interestingly, patients often have varying triggers, so it can take time to identify the specific factors for each individual. Let me give an example. I once treated a 34-year-old man named Mark, who came in because he was experiencing constant redness and occasional swelling around his nose and cheeks. He had tried multiple over-the-counter treatments, assuming he had acne, but none provided lasting relief. When we discussed his lifestyle, he mentioned he enjoyed outdoor sports and was frequently exposed to direct sunlight, which is a common trigger for rosacea. After making a few lifestyle adjustments, such as using sunscreen with a high SPF and limiting his time in the sun, along with starting a prescribed topical treatment, his symptoms improved significantly. Treatment for rosacea varies depending on its severity. In mild cases, topical treatments, such as metronidazole or azelaic acid, are typically prescribed to help reduce inflammation and redness. For patients with more moderate to severe symptoms, oral medications like doxycycline may be used. Laser and light-based therapies can also be effective in reducing visible blood vessels. However, it's important to understand that while these treatments can help manage symptoms, they don't cure rosacea. Patients must continue to avoid their triggers, and they need to recognize that treatment is more about control than elimination. In another case, I had a 42-year-old woman named Lisa who had been struggling with rosacea for years. She described the constant flushing of her face as embarrassing and reported avoiding social gatherings out of self-consciousness. This is common among people with rosacea, as the condition has been linked to higher rates of anxiety and depression. I worked with Lisa to develop a comprehensive treatment plan that included a mild cleanser and a topical cream, along with behavioral changes to manage stress, another known trigger. Her condition improved over time, though it required persistence and patience. Dietary factors can also play a role in rosacea management. For some patients, foods that raise body temperature, like hot soups, spicy dishes, and alcohol, can trigger flare-ups. Additionally, avoiding foods high in histamine, like fermented products, may help minimize symptoms. That said, dietary changes alone won't eliminate rosacea, but they can be a helpful part of an overall management strategy. For example, a small study suggested that people with rosacea who avoid triggers such as alcohol and spicy foods see a noticeable reduction in flare-ups. Ultimately, we must consider the chronic nature of rosacea. Even with effective treatments and lifestyle adjustments, patients should understand that flare-ups may still occur periodically. Working closely with a healthcare provider to adjust treatments as needed can make a meaningful difference in the quality of life for those living with this condition.
That is the end of Part C. You now have 2 minutes to check your answers.